Scleroderma is a chronic autoimmune disease. It affects the skin and connective tissues. The body's immune system mistakenly attacks healthy tissues, leading to an overproduction of collagen. Collagen is a protein that provides structure and support to tissues. In scleroderma, the excess collagen causes the skin to harden and thicken. It can also affect internal organs like the lungs, heart, and digestive system. Scleroderma is relatively rare, affecting women more often than men. The disease can occur at any age, however. It is most commonly diagnosed between the ages of 30 and 50. Scleroderma is not contagious. It cannot be spread from person to person through contact. The symptoms of scleroderma vary depending on the type and severity. Common symptoms include skin thickening, Raynaud's phenomenon, joint pain, and shortness of breath. The exact cause of scleroderma is unknown, however. It is believed to be a combination of genetic and environmental factors. There is no cure for scleroderma, but treatments are available to manage the symptoms and slow the progression of the disease. Early diagnosis and treatment are crucial in managing scleroderma effectively. It is essential for individuals experiencing symptoms suggestive of scleroderma to seek medical attention promptly. Scleroderma is broadly classified into two main types: localized scleroderma and systemic scleroderma. Localized scleroderma affects only the skin and sometimes the underlying tissues. Systemic scleroderma can affect internal organs in addition to the skin. Localized scleroderma is further divided into two subtypes: morphea and linear scleroderma. Morphea is characterized by oval-shaped patches of hardened skin, which can be reddish or purplish in color. Linear scleroderma appears as a single line or band of thickened skin, often affecting the arms or legs. Localized scleroderma generally does not affect internal organs. Systemic scleroderma is divided into two subtypes: limited cutaneous scleroderma and diffuse cutaneous scleroderma. Limited cutaneous scleroderma is characterized by skin thickening on the hands, face, and feet. It can also affect the esophagus and lungs. Diffuse cutaneous scleroderma involves more widespread skin thickening and is more likely to affect internal organs such as the heart, kidneys, and lungs. The type of scleroderma determines the course and severity of the disease. Localized scleroderma tends to be milder than systemic scleroderma. However, systemic scleroderma can lead to serious complications if left untreated. The exact cause of scleroderma remains unknown. However, researchers believe that it is a complex interplay of genetic predisposition and environmental triggers. While having a family history of scleroderma doesn't guarantee you'll develop it, it does increase your risk. Certain environmental factors have been linked to an increased risk of developing scleroderma. Exposure to certain chemicals such as silica dust and solvents has been implicated. Viral infections are also suspected to play a role in triggering the autoimmune response in some cases. Women are more likely to develop scleroderma than men. The reasons for this gender disparity are not fully understood. Age is also a factor, with most diagnoses occurring between the ages of 30 and 50. While scleroderma can affect people of all races and ethnicities, some groups, such as African Americans, may be at higher risk. Understanding the potential causes and risk factors associated with scleroderma can help individuals make informed choices about their health. While some risk factors like genetics are beyond our control, others, such as limiting exposure to certain chemicals, are modifiable. While there is no guaranteed way to prevent scleroderma, certain precautions can help minimize the risk or manage the condition effectively. Maintaining a healthy lifestyle is crucial for everyone, especially those with a higher risk of autoimmune diseases like scleroderma. Avoiding exposure to known environmental triggers is essential. If you work in industries that involve contact with silica dust or solvents, take necessary precautions such as wearing protective gear. Regular hand washing and avoiding contact with sick individuals can minimize the risk of viral infections. Early diagnosis and treatment are crucial in managing scleroderma effectively. If you experience symptoms like skin thickening, Raynaud's phenomenon, or shortness of breath, consult a healthcare professional promptly. Timely intervention can help slow the progression of the disease and prevent complications. While these measures may not entirely eliminate the risk of developing scleroderma, they can contribute to overall well-being and potentially reduce the severity of the condition. Remember, knowledge and proactive measures are your best defense against scleroderma. Scleroderma is a complex autoimmune disease that can significantly impact an individual's life. Understanding the basics of scleroderma, including its types, causes, and potential risk factors, is crucial for both patients and their families. While there is currently no cure for scleroderma, early diagnosis and treatment can help manage the symptoms and slow the progression of the disease. Living with scleroderma can be challenging, but it's essential to remember that you are not alone. Support groups and online communities can provide valuable resources and a platform to connect with others facing similar challenges. By staying informed, taking proactive measures, and seeking appropriate medical care, individuals with scleroderma can strive for a good quality of life. Remember, knowledge is power. The more you know about scleroderma, the better equipped you'll be to manage the condition and make informed decisions about your health. Stay positive, stay proactive, and never hesitate to reach out for support when needed.